1 in 17 people have a rare disease, so collectively it's a lot of people. You can feel quite isolated. You may not know or be able to speak to many other people with your condition. I think it's important for people who are diagnosed with a rare disease to tell their story, ultimately to make the life experience for people who are coming behind better, so that when people are diagnosed with the same condition in 5 years, 10 years' time, will not have the same minefield to negotiate through. There will be more awareness, better services, better support, so they will have a better life experience through that diagnostic odyssey and through the treatment. My name is Angela and I have Antiphospholipid Syndrome, which is a rare autoimmune blood clotting disorder. I was diagnosed in 2004 after suffering several miscarriages. Antiphospholipid syndrome can present in many different ways. It can affect any system in the body or any organ in the body. The kidneys, the heart, the brain. For myself, the things that I have experienced have been obviously the recurrent miscarriages, which prompted the diagnosis. And then I've had problems during pregnancy with hearing loss, which responded well to treatment, and migraines, which can occur really at any time. I've also experienced problems with fatigue, which can be on and off. Again, you can have years with no problems at all, and then suddenly months and months of fatigue. The prevalence of antiphospholipid syndrome is about 1 in 2,000, although it may be greater than that because it is hard to diagnose, so there may be a significant number of people who aren't diagnosed. When I experienced the miscarriages, I did a lot of research online to look at causes of miscarriage and to get some investigations done by my GP and by the hospital to try and find out if there was an underlying cause for the miscarriages. When I was diagnosed, I think the initial thing that I felt was relief, because I had got a reason for the miscarriages that we were suffering, and then got treatment, which led to future successful pregnancies. My APS was treated with taking a daily tablet, an aspirin tablet, and also a daily blood thinning injection called heparin, which I gave myself every day. Then following the pregnancies, I moved on to taking a daily tablet called warfarin, which again thins the blood. So these were all to try and prevent blood clots forming. When I went through my 2 pregnancies, the antiphospholipid syndrome flared a bit in the second one. So I was suffering quite badly then with migraines on a daily basis. Migraines for me tend to give me visual disturbances and also sensory changes. So things like tingling or numbness can be in your face, it can be in the hands or in the feet. The things that really help in terms of stopping the migraines or preventing them occurring in the first place are things like making sure you've got a regular sleep pattern, regular exercise, regular eating pattern, avoiding too much stress and getting overtired. Those are definite triggers for me. It's really important for healthcare practitioners to listen to what the patients are saying, because often patients will have done a lot of research on their own, and especially if they've already been diagnosed with a condition and they're bringing you forward symptoms that they think are related to that condition, you will find that they're an expert on their condition. NIRDP have also done a lot of work with healthcare professionals as well about raising awareness of rare diseases, just to try and get the GPs, who are your initial point of contact, to think, could this be a rare disease? Could this be this? And then start the ball rolling in terms of investigations. When any patient presents with a symptom, rare disease or not, their first point of contact is with their GP in primary care. A GP in their practice may have someone with that rare disease, or they may not. With APS, they may have one person in their practice with that, or they may have no one. So they can't be expected to know everything about every rare disease. That's impossible. So they refer on to the consultant at secondary care at the hospital. For most people with most diseases, that will be enough. For a consultant in secondary care, they will see more people with that rare condition, but again, depending on the rarity of the condition, depending on its prevalence, that again may not be a significant number of people. Tertiary care is really the level above that, and that would be the specialist in a particular disease. So a specialist, in my case, in antiphospholipid syndrome. And they would be able to develop the expertise and the up-to-date knowledge of managing that condition. It's really important to have networks set up for rare diseases so that consultants, if they're dealing with a rare condition that they feel they don't have the expertise to manage or they have a question about, can refer on to a specialist in that particular condition. So you may get to see a specialist within Northern Ireland for your condition, or they may be wider afield. For some very rare diseases, it may be the specialist is in Europe or international, in the States or somewhere else. This is one of the things that will improve the care for rare disease patients the most. And it's something that I would encourage policymakers to develop more of, networks of care. When you have a rare disease and you're trying to get your diagnosis or you're trying to get management for your condition, and it's significantly affecting your quality of life, you will travel wherever you need to. The patient voice is essential when you're developing any sort of policy or service improvements for any disease, but especially for rare diseases. I was a policymaker before I became a patient. So I always believed in the importance of the user experience and the user voice in developing policy. But since I've become a patient and I've experienced that diagnostic odyssey and the difficulties that you can have in getting treatment plans, I would just feel even stronger that it's really important to listen. People who've lived through this experience know what it's like. So it's really important to include them. It's really important to stop and to listen to the problems that they experienced, the obstacles that they experienced, and indeed what was good for them, what was working for them, and to use all of that in developing your policies and improving your services. We're in a really good place at the moment. NIRDP have campaigned over the last 10 years very strongly. And what NIRDP have done is pull that voice together into a collective strong voice to advocate on behalf of the rare disease community in Northern Ireland. And they've been very successful. NIRDP has got a seat at the table with the policymakers and has been involved in developing the Rare Disease Action Plan, putting forward the voice of all those people in Northern Ireland with a rare disease, and that's been really important. Although we're in a very good point, we also have a number of difficulties happening at the moment. The political landscape at the moment is not functioning as it should be currently. So that would be of concern, and we don't want to allow that to stall the progress that we are making and the implementation of the Rare Disease Action Plan. So it would be really important for us as a charity to campaign and push hard to keep that momentum going and ensure that those actions are taken forward and are implemented. One of the things that being diagnosed with a rare disease taught me about life is that you never know what life is going to throw at you. So make sure that what you're doing with your life is what's important to you, and that you're making time for the people that's important to you and that mean the most to you. Never underestimate your capabilities. You can cope with much more than you think you can. You may find yourself very unwell, but there is light at the end of the tunnel. You will get better, things will improve, and you will get back to doing what you want to do and what's important to you.